Hi there everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is excoriation disorder, also known as skin picking disorder? Ooh, ah. Okay, we're ready to get into what is excoriation disorder, also known as skin picking disorder, but before I get into that, I just need to say that this is not the diagnostic criteria for this disorder. It's just a description. It's not meant to be used to diagnose anybody. You'd have to see a licensed professional for that anyway. And if this label of excoriation disorder or skin picking disorder bothers you in any way, if it doesn't help you to heal or a loved one that you know to heal, you don't have to use the label. This is really just to point you towards something that could be going on in the life of someone you love or in your own life. That said, and out of the way, I do have notes to get through what is excoriation disorder, what is skin picking disorder. So it is a repeated picking at your skin which leads to skin lesions. And in the process of this disorder, there are attempts to stop picking at the skin, which often it's hard to do, when you have a disorder like this, which subsequently causes stress in your daily functioning. And it's not something that's due to a substance or a medical condition, for example, something like eczema or a dermatological condition. That would not be an example of excoriation disorder or skin picking disorder. And it's not something that's better explained by a psychotic disorder, which features things like delusions or tactile hallucinations. It's not better explained by attempts to modify your body, such as in body dysmorphic disorder, or stereotypies in stereotypic movement disorder or self-harm. So none of those things are what's going on. This is just picking at the skin. So there is treatment for this, and you could use something like cognitive behavioral therapy or acceptance and commitment therapy or medication when appropriate. Really just go in to see a professional and they'll be able to help you out if you find that you're having this going on in your life. So what does it feel like to have excoriation disorder or skin picking disorder? Well, first, in the body, you're probably going to feel some anxiety symptoms. It is stressful, so you may find that your heart races a little bit, you sweat, maybe some muscle pain, joint pain, that kind of a thing. You're probably going to have a little bit of pain or itching from the lesions that have been created, possible scarring, tissue damage, and infection. And it could turn into something more serious that would lead to requiring surgery. So this is something serious. It is something to take seriously if you find that it's going on. I don't want to scare anybody, but don't let it progress. Don't let it get worse to the point where you need to get to surgery. Go in and get help when you can early on. In your mind, things that may be going on is you may spend time thinking about that you want to pick your skin, or you may spend time actually fighting against those urges. Emotionally, you may feel a little embarrassed or ashamed that you do this. You may feel like you're a little bit out of control, and you may feel that urge to pick your skin when you're bored or when you're feeling anxious. And you may then in turn feel relief once you have finished picking. Behaviorally, what the types of things that you're going to do are obviously pick at your skin, and that could be anywhere on your body. It doesn't have to be, common places are like the face, the arms, legs, but it could be any place on your body, and it could be not just with your fingers. You could use things like tools. You could use tweezers or chopsticks or any kind of tool that you can imagine, anything that would pick at the skin. Hair comb, any kind of, really anything. Everybody has their own kind of thing, and that's another thing when it comes to the behavior, is there's often like a ritual kind of component to it where you have your way of picking at things. So you may squeeze, you may rub, you may bite, you may lance the skin, often for several hours a day, and you may do things if you have like a ritualistic way that you do it, you may play with the skin, examine it, swallow it. You may be more automatic about the skin picking and not really realize you're doing it. You just kind of do it. Or you may be much more deliberate in the case of things like the ritual. And you may actually decide to pick other people's skin. So you might try to cover up the lesions that form when you do skin picking with clothing or makeup. You probably have attempted to stop multiple times, and because of this you may avoid social situations or avoid things at work. You may have difficulty in those settings. So again, this is excoriation disorder, skin picking disorder. It is serious. It's not like a joke or anything. And again, if it gets to the point where it may require surgery, let's try not to let it get there. Let's get into see somebody that can help us. But I appreciate you taking the time to learn about it with me. If you have an experience with this disorder, I'd love to hear about it. So please leave it below, leave a comment, and I thank you for being here. Thanks. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.